بسم الله الرحمن الرحيم. أنا أخوكم عمر Urology resident at Armed Force Hospital. تسمعني يا مشاري؟
اي نعم دكتور، صوت واضح.
أنا أخوكم عمر Urology resident at Armed Force Hospital Southern Region. Tonight we will have a small talk about urology specialty, who's urologist, and I'll try to shine light on a urology program in Saudi Arabia. So urology includes kidneys, ureter, bladder, prostate, urethra, testis, and more. Urology also deals with some of the most sensitive parts of the health, including sexual function, fertility, and urine incontinence. For this reason, urologists are well versed in having complex, quality of life conversation and delivering compassionate care. Urologists are in fact real surgeons. They don't treat UTI all the day. Actually, the residency program involves a rigorous surgical training, and they are experts at operating on various structures within the pelvis. Many also believe that urology only applies to men. Turn out, many women seek treatment for a urologist for a cancer of urogenital tract and issue with voiding. In fact, there are even some subspecialties with urology that treat women almost exclusively. Although there is some overlap between OB/GYN and urology, the gynecologists focus primarily on a female reproductive tract, whereas urologists typically focus on male reproductive tract and urinary tract of both men and women. So urology is unique among surgical subspecialty because of blend of clinical medicine and surgery. Earlier on, as a urologist career, they may focus on a surgery, but it's common for older urologists to phase out and focus more on the clinic, as they may be less enthusiastic about standing in the operating room for hours at a time. One more thing, we also perform a small procedure in the clinic, like truss, Botox injection, cystoscopy. In the OR, we have a wide variety of cases. A urologist may break up kidney stone, vaporize prostate by using laser, or they may use a robot laparoscopic procedure for nephrectomy and cystectomy. Urologists also perform a variety of open surgeries with kidney transplant and lymph node dissection. Urology has high degree of procedural variation. One day you may be performing a quick in-office vasectomy, which will take less than 30 minutes. Next day, a complex bladder reconstruction lasting several hours. Some urologists may enjoy the complex life or death surgery, where you carefully dissect all around the aorta and vena cava, removing lymph node and curing a patient of cancer. Others may like a quick but equally satisfying cases where you retrieve a large stone and relieve patient of some of the worst pain in their life. The uro-oncologist also, who save the day or the quality of life, help the patient to stay continent or anything in between, actually. And this raises the question, should be academic or community urologists? Actually, the urologists that practice in academic setting focus on a research, teach a resident, take care of patient inside and outside operating room. The practice of community can vary quite a bit from spending most of their time in the clinic to spending majority of their days in the operating room. Regardless, these urologists devote 100% of their time in a patient care. Regarding the residency program, actually the first year, usually outside urology, which is a general surgery rotation for 9 months and ICU rotation. The general surgery to develop fundamental surgical skills, and there's a majority of your time will be spent learning how to manage floor patients, which is really important in urology program. As a junior resident, you will see urology patients that come from emergency department, managing patients on the urology floor and working on small cases. Few BGY 4 and 5. Now it's time to shine and learn as much as you can in the OR. You'll be doing a larger open cases like kidney transplant and large reconstructive and oncologic cases. You will also be mastering the use of surgical robot to resect kidney, bladder, prostate cancer. There's also much more responsibility come with it. Administrative duties to make sure everything within urology service is running smoothly. Also, the research on urology is really important, which will improve the treatment of urological condition. Is being translated into therapies, surgical technique, diagnostic tool, and are saved living every day. The clinical trial, actually, to be honest, I didn't see it here on the program here, but inshallah it will come in the future. The clinical trial are highly regulated health-related research studies that help advance disease therapies into clinical practice. So, having said that, I think urology is unique. Usually, the urology applicants, they have sense of humor, doesn't take themselves too seriously, and love OR. If you think about it, if you have the skills of general surgeon and the kindness of family medicine doctor, you will be a urologist. But at the same time, there is a high competition. Yes, the score is important, but also a letter of recommendation hold heavier weight. Because urology is small specialty, where urologists all know one another. A glowing letter from prominent urologists can transfer applicants from below average into more attractive applicants. That's why I highly recommend outside rotation as much as you can if you're still interested in urology. And this allows the student to embrace prominent leader in the field and secure strong letter of recommendation. There's a lot of subspecialties after completing your urology residency. For example, andrology and infertility. 50% of infertility in a couple is due to men. So the urologists specializing in andrology are men health champion and specialists in infertility, sexual dysfunction. They can perform surgical sperm extraction while operating under microscope. The fellowship also can teach to perform a penile prosthesis, spermatic cord denervation, and even reverse vasectomy. The female pelvic medicine and reconstructive surgery, including repairing fistula, reconstructing urethra, creating urinary diversion from intestine, and resolving vaginal prolapse. The transplant surgery, usually it's 2 years and relatively small compared to others. And most of the transplant surgeons come from general surgery residency and are trained to perform solid organ transplants in addition to the kidney. These people are adrenaline junkies and perfectionists of urology. Every detail and every suture need to be perfect to have a successful transplant. The endourology and robotics, you will have your skill on surgical robots dealing with some of the most complicated urology cases with minimal invasive approach. And there are even treatment modality by benign prostate disease by using a laser. The uro-oncology, it's usually 2 to 3 years fellowship with a research year where you're specializing in uro-oncology. These people build a long-term relationship with their patient as they will follow a patient for several years before deciding to operate and will continue to follow their patient for the rest of their life as the urological cancer tend to recur. The pediatric urology, they deal with all the urological issue of children, including hypospadias. And also there is more complex cases too. For example, children who born with severe anatomical birth defects, pre-crowding normal urination, may need surgery that allow them to catheterize themselves through abdominal wall. Usually the pediatric urologists are especially meticulous and precise as they are dealing with smaller structure than other urologists. This in general the most common subspecialty in urology, and I try to mention that because it's a wide subspecialty. So there's a lot to love about urology. First, much better work-life balance compared to most of the surgical specialty. And after residency, expect 40 to 60-hour work per week. Your patient also will love you because many of the intervention will have immediate and positive effect on their quality of life. The urology patient tend to suffer from sensitive health issue for many years before they seeking care. And really they are understanding if you maintain their continence, for example, throughout the day. There is a great deal of variety in urology, and you can adjust based on your preference over the course of your career. The younger urologists usually tend to have more energy and choose the most complex oncological surgery most of the day of the week. But if you get older, you can make a transition to a primary clinic focus to practice with some minor surgery at the site. Having said that, yes, I believe urology is amazing, but it's not perfect. In fact, the urologists have some of the highest burnout rate reported among all the medical field. The recent Medscape burnout report showed the urologist at the top with 54%. Urology also a specialty that has condition requiring immediate and urgent treatment. That means you can be called during the middle of night for a patient septic from infected kidney stone. Also, the urology complication can be some of the worst, including gross hematuria, prosthesis infection, extreme electrolyte abnormality that can be life-threatening in a patient who have had a cystectomy or nephrectomy. And as other surgical residency, you can expect 80-hour work per week during your training residency. If you still want to be a urologist and you love to work with your hand, you like to read about the pathophysiology of medicine, you want to build a long-standing relationship, and you like to be in OR, I think urology is a good fit for you. If you want to be a surgeon but still have a healthy work-life balance, urology is unique in being able to provide that. Urologists also love playing with new gadgets, laser, instruments in the OR. All this, we can use it in the OR actually. But at the same time, urology is a highly competitive field. You will need to crush your board score, home and away rotation, and knock it out with the research too. Finally, if you're interested in urology, I encourage you to visit AUA.com, American Urological Association. There's a lot more things there. I think urology, one of the specialty who have medicine, surgery, and advanced technology too. Thank you so much. If you have any question.
الله يعطيك العافيه دكتور عمر.
الله
شاكرين ومقدرين لك، كتب الله اجرك.
الله يجزاك.
ما ادري اذا في احد من الحضور عنده اسئله ممكن يشاركنا عن طريق الشات، او ممكن يرفع يده اذا حاب يشارك بصوته.
انا ما اعرف كيف الطريقه اني اقرا الشات هنا يا مشاري.
راح اقراها لك، ما في مشكله دكتور. سؤال يقول: طبيعه عمله نفس الجراح؟
اي نعم، نفس الجراح. فيه مميزات انك تقدر يعني مع وقت العمل ومع اذا كبرت في السن تقدر تنتقل مثلا من الجراحات الثقيله اللي تاخذ ساعات الى جراحات يوميه، الى جراحات ان اوفيس بروسيجر مثل بوتوكس انجكشن، هذا يكون ان اوفيس. وفي نفس الوقت يعني عندنا وحدة المسالك في المستشفى العسكري الآن فيها a lot of in-office procedure مثل تراس ESWL. إن شاء الله near future بيكون في بوتوكس injection، بعض المستشفيات فيها. فهذه تعطي تنوع حتى وقت العيادة، إنك تشوف بعض المرضى في العيادة بعدين تنتقل تعمل بعض البروسيجر وترجع تشوف البقية. هذه تعطي تنوع وتمنع الملل. جاوبت سؤالك؟
تمام جدا. ما أدري إذا باقي أحد عنده أسئلة، بس ما في شيء في الشات حاليا.
طيب
الله يعطيك العافية دكتور.
بس
ممكن
آخر نقطة يعني ضروري جدا سواء نيورولوجي أو أي تخصص آخر، إن الشخص يحاول قد ما يقدر يأخذ روتيشن في أكثر من مستشفى عشان يعرف البيئة، وسواء هذا الكلام ينطبق على اليورولوجي أو أي تخصص آخر. وأتمنى التوفيق للجميع.